All right, everyone, and good evening, and welcome to ASDA's first ever Advo-cast. Tonight's topic is action-oriented licensure reform. Advo-casts are the Council on Advocacy's new webinar format, where we'll be having bite-sized discussions on big issues. If we could go ahead and move on to the next slide. Questions tonight will be addressed after the presentation is complete. But during the presentation, feel free to go ahead onto that side panel there and type in your questions. They'll go right to the chat box, and the three panelists will address those questions at the end of the webinar. The agenda for tonight's Advo-cast is to review ASDA's efforts to remove the live patient portion of the dental licensure exam. We'll then move over to two of our panelists, first to discuss how Iowa will move away from the live patient exam, and then we'll take a closer look at how Connecticut's recent legislative successes advanced licensure reform in that state. So for tonight's panelists, I have the pleasure of introducing first myself. I'm a third-year dental student at the University of Pennsylvania. I have the honor of serving as this year's national president for ASDA, and I represent ASDA on the Coalition for Modernizing Dental Licensure, as well as the American Dental Association's Council on Dental Education and Licensure. Our next panelist is Dr. Sean O'Neill. He is a general dentist and owns several practices in Iowa. He graduated from the Iowa College of Dentistry in 2017 and served as ASDA's District 8 trustee from 2016 to 2017. While still a student in Iowa, he led the licensure reform effort there. And our final panelist tonight is Dr. Monty McNeil. He is a professor and dean emeritus at UConn School of Dental Medicine. He currently serves on the Coalition for Modernizing Dental Licensure, representing the American Dental Education Association, and he is a past chair of the board for ASDA. Also on tonight's call, we have two of our staff members from ASDA, Stephanie Follett, the Director of Strategic Initiatives, and Keely O'Sullivan-Kurtz, ASDA's Advocacy and Policy Manager. So I'll be taking the first few slides for tonight's webinar. Just as a very quick overview to the dental licensure process, to become a licensed dentist in the United States, there's three components. The first one is an education requirement, and that's graduation from a CODA accredited dental school. The second is the knowledge requirement, or passing of the national boards. And finally, there's a clinical component as well. And this is kind of where ASDA has the most issues due to the ethical nature of the exam. In most states, this clinical examination is conducted on patients. It's sometimes referred to the live patient exam, and there's several controversies surrounding it. Often this exam is on a patient that is not of record at the dental school. There's usually an exchange of some sort of cash to get the patients to show up for the exam. And among other issues, an exam on a patient is truly impossible to standardize or reproduce. So if we take a look at the next slide, I just kind of want to bring you through a quick overview of ASDA's movement through the licensure reform process. And while we've been at it for several years, 2016 was a big year for us when we updated our L1 policy. And this has clarified the stance of ASDA on licensure modernization. So ASDA advocates for an exam that does not use human subjects in a live clinical testing scenario. We want an exam that's psychometrically valid and reliable, basically meaning that the students that should be passing the exam, that are competent to practice on the public, are passing, and those students that are not yet ready to practice on the public are not passing the exam. We want an exam that's reflective of the current scope of dental practice. So as everybody on this call tonight knows, dentistry is so much more than a class 2, a class 3, and a quad of SRP. And finally, we want an exam that is universally accepted to allow professionals to move across state lines without having to worry about their license being valid there. ASDA goes a little bit further with our L1 policy, and not only do we say what we want out of an exam, but we also propose our ideal exam, which is a mannequin-based kinesthetic assessment, an OSCE, which is the objective structured clinical exam, similar to the way that Canada licensed their dentists. And finally, we want all candidates to submit a portfolio of comprehensive patient care. So following the adoption of the white paper in 2016, or following the adoption of the L1 policy in 2016, we have the release of ASDA's white paper entitled Use of Human Subjects in Clinical Licensure Examinations. It's a completely evidence-based paper that compiles years of research on this subject. And the conclusion in this white paper are the foundations for ASDA's L1 policy, as well as for our grassroots advocacy efforts. So students have taken action in several different states. The most notable is probably Colorado, where past ASDA President Christian Pierce collaborated with the State Dental Association as well as a committee on of the State Dental Board. And that committee on the State Dental Board voted to accept the hybrid portfolio, the OSCE, PGY1, as well as all 5 regional exams, essentially making Colorado the only state that accepts every pathway to licensure. Also in that year, Kentucky, with the 2015 to 2016 Executive Committee, Adrian Lewis, Niv Rajagopalan, and Christian Pierce, along with ASDA staff member Stephanie Follett, worked closely with the Kentucky Dental, Board, resulting in the acceptance of the California portfolio model for licensure in that state. And finally, a collaboration between students and various other interest groups in Washington led to the State Dental Board in that state accepting the OSCE. And we're very lucky to have Sean on tonight's call, who will be discussing Iowa in just a few minutes. In October of 2018, just a couple years after the adoption of our L1 policy and the release of our white paper, 3 of the largest dental associations in the country came together to form the Coalition for Modernizing Dental Licensure. So that's ASDA, along with the American Dental Education Association and the American Dental Association. ASDA is a founding member of this association, and we have 2 representatives on the executive committee. And there's now over 25 member and supporting organizations that have come together, such as the American Association of Orthodontists, the Oral Pathologists, and several state associations, as well as several dental schools. So it's important to note that while ASDA was successful in our grassroots efforts in previous years, we really hope that our collaboration with these 2 other groups and these other groups that are joining as members and supporters are really going to help us have a larger national impact on this issue. Since forming in October of 2018, you'll see that the coalition has had quite a bit of work in front of us. So since forming in October of 2018, the executive committee of the coalition has met several times in Chicago, where we've been discussing reform strategy and what states we want to move into first. We've also been busy recruiting new member and supporter organizations that will help support our mission and goals of eliminating the live patient exam and expanding licensure portability. I'm really excited to share with our members that just last week in Chicago, we brought together the member and supporter groups along with the 3 founding associations to have a meeting where we were able to hear state success stories, a little background on licensure, 2 alternative pathways to licensure currently in process. And then the afternoon, we brought various groups from different states together to discuss different strategies that they could use back home to advance the mission of the coalition. This last slide that I have, I really just want all of our members to know how much goes on behind the scenes. ASDA is always working to share our policy and our point of view with other stakeholders and organizations to push for a valid and reliable pathway to licensure. As ASDA members, you should feel very confident that you have a strong team of leaders and staff advocating on your behalf. And now I'm really excited to hand it over to Dr. Sean O'Neill, who is going to discuss a little bit about the student-led effort in Iowa.
Thank you, Craig. As Craig said, I graduated from the University of Iowa in 2017, and during my time there as a student, one of the big things that I did, or that our ASDA chapter worked for, was licensure reform. And that was something that I worked on pretty extensively. And I I'm going to go through kind of a general overview of the situation, the history, and what happened, and talk about a few of the points that were really successful for us. So if we go to the next slide here, you'll see the history in Iowa. Prior to 2016, prior to this legislation, the dental board in Iowa made it mandatory that Iowa students had to take the credits regional board exam to get licensed in the state of Iowa. It was the only one that would allow an Iowa student to get a license in Iowa. One of the interesting things about that is, due to some concern of portability or getting dentists to come in from other states, they then opened up that somebody graduating from any other dental school in the country could take any other exam other than credits and get licensed in Iowa. So really it was only Iowa students being forced to take credits. Any other student could take any exam and get licensed. And most of this happened in 2008, 2009, when one of the Iowa Dental Board members was the chair of the steering committee for credits. So just a little bit of history there, and some of that will play in as we get on later in the presentation. So post legislation, where it's at now is all regional exams are now accepted in Iowa. There is a patient-free pathway. That pathway right now that's accepted is the portfolio, but there was also some verbiage that was added that would allow for future pathways that were patient-free to be added. Basically, if they were recommended by the ADA, that it would be open through that legislation that they could be possibilities for the future. So some of the issues that you'll know with patient-based exams, and some of this Craig might have highlighted a little bit, but they were validity, reliability, and ethicality. When I approached the legislation, my main attack to the legislation, and when I would approach representatives, were the ethicality of the exam. Basically trying to explain to them how unethical everything that the students were being forced to do really was. And that wasn't overly effective. One being, most representatives, most people that work in that area that are not dentist specific don't really understand the exam. They don't understand dentistry, and frankly put, most of them didn't care about the ethics. And that's sad to say, but I had several representatives saying, I don't understand this, and you're not making an argument that I can understand. This is why we appoint a dental board, isn't it? And so it was kind of a roadblock there. The other issue we had with credits, as I mentioned on the previous slide, was the conflict of interest. Iowa Dental Board members were serving on the credit steering committee, yet they were forcing us to only take that exam. And then one of the other big things that was coming to me when I took over as the president-elect of the Iowa chapter of ASDA was a bunch of fourth years coming in talking about the negative patient-student experiences, extortion, threats, failures when patients wouldn't show up. There was, I think, a 3-year period that out of the 80 students, on average, 7 would fail. 6 of the 7 were failing because their patients didn't show. Only 1 of the 7 per year typically was due to something clinically over like a 3 or 4 year average at the time. So it kind of showed some of the issues with the exam. And this last bullet point there, the negative patient and student experiences, was really what I used to drive licensure forward, or the legislation forward, in Iowa. And that was what was most successful when I was talking about that with the representatives. And the reason I think that is because the representatives can understand those experiences, extortion, threats, and how the students are being treated, because most of them had children themselves that also went through high school and college, and so they could relate a little bit closer to that. And if we go to, there it comes, legislation. So, it was kind of a two-prong approach. I approached it in a way that I wanted to be able to fix the conflict of interest that was occurring in the state, and the restriction of the portability that only allowing credits, or only having credits in the state, was forcing. We have a lot of students at Iowa that like to go west to, states on the West Coast. I had 4 classmates that wanted to move to Washington. I had classmates that were moving to Oregon, and credits wasn't being accepted in all of those states at the time. So they were being forced to travel across the country to a different program or different school to take a licensure exam just so they could practice on the West Coast afterwards, because Iowa was not able to offer any of the other exams at the time. The other part was to find an ethical exam that had the known reliability and validity that the regional board exams were not showing. And so to gain support for the legislation also took kind of a two-prong or three-prong approach. The first thing was the faculty and administration at the college. That was probably the easiest step for me. Our dean at the University of Iowa has been one of the biggest opponents, I think, to licensure for about 20 years, and makes that known every single year at both the ADA meeting, ADA meetings, all of those meetings. In addition, the faculty had actually recently had a school-wide vote that, and I don't have the numbers in front of me, but I think it was 93% of the faculty strongly agreed that the exam for students to perform unethical treatment on patients. Only 7% were neutral, and there was nobody that disagreed with that statement. So it's pretty astounding that 93% of faculty strongly agree that the exam forces students into unethical clinical situations. The next area of support for legislation was dental students and student government support. So the dental students, were pretty easy to get behind this. They looked at it any way to get out of taking credits was probably a positive. So that was an easy step, but it was educating them on the reasons that are in the L1 policy in the white paper. That was the important step there, so that when they would go talk to representatives and legislators, they were well informed and could speak knowledgeably about the subject. The next step that I did is I went to student governments. So ASDA, being a student government of the dental school, I sat on a graduate government of all of the graduate programs at the University of Iowa. And I took it to that meeting and got the graduate professional government at Iowa to make a stance. That government that made that stance also had voting members on the Board of Regents and other boards and panels throughout the entire university. By the graduate government making a stance, it was kind of forcing the university to no longer ignore this subject. So the university for years had kind of been ignoring the dean's request to the provost and to the president to get involved in this situation in Iowa. After the students made this public, the university didn't really have a choice but to make a stance. And then that leads kind of the last thing, is getting the university support of the provost, the president, to stand behind the dean in a legislative matter. Sometimes deans have to be very careful what they can and cannot say, because they serve as part of a larger institution where they're worried about things coming from the provost. So we had to get them behind the legislation so that the university was supportive, so that the dean could be as supportive as we wanted as well. On the next slide here, we'll talk about navigating some of the pathways that we went through. So when I started all of this process, I didn't realize how many steps to creating a legislative act there would be, how many committees, subcommittees that I would have to go through. To me, should have been as simple as writing a legislation and having it voted on, but it's really not that simple. And so after I had the support of the University or College, the support of the Board of Regents that forced that action, then I used the legal committee at the university to help draft legislation with me, and then found legislators that were often associated or close friends of the university to help start pushing forward. And really the key is the legislation, in order to get it pushed forward, it's going to be put in a subcommittee that's part of a committee. And I use resources both at the university and the graduate government, and serving as the governmental relations chair for the entire university at the time, to know which committee it would go to first, and then finding the members of that committee and seeing who I could target that would be supportive of such an action. So it was a lot of homework, a lot of things done behind the scene, as Craig said, but I went in and studied the profiles that are often online of every member in the subcommittee and committees that I thought this bill could possibly go through. And then inside of those people, I had to find somebody that I thought could champion this bill all the way through. And what I mean by that is typically for a bill to pass, you have to have a representative or a senator that is 100% supportive and willing to kind of stick their neck out to push something through. And I was able to find that person in the one of the representatives in one of the committees that I knew this could go to. And so that was really the huge success part for us, was getting somebody that would continue to push and not give up. It is a very slow process, and one of the most important things is not losing hope in that process. From start of this legislation to the time it was passed was over 12 months in Iowa. It was about 16 months from the time that the legislation was pretty much first introduced as a possible bill to the time that it was finally passed. And that 16 months, like I said, most of it was doing homework on the representatives, on the subcommittees, on the committees, and being able to find the navigational pathway that I could get through after I had all the support that I felt that was needed at that time. So I know there will be questions or time for questions here at the end, so I think it's time that we pass it on to Dr. McNeil.
Great, thank you, Sean, and thank you to everyone who's attending this for taking some time this evening. I have to start by saying it's been a very much a pleasure to work with ASDA leadership on the coalition. That includes Craig McKenzie, who's here with us tonight, and also Rupali Kulkarni. Just been excellent representatives. And in my 40 years of dentistry, there has not been, I used to say, I don't think there's a time when we have the best chance to change the licensure landscape. I'm going to take the think part out of that. There has been no better time to achieve those things that so many of us have been searching for so many years. So the next slide, please. So let me describe the Connecticut situation and lessons learned there. About 80% of what Sean said coincides with the Connecticut experience, and every state has a certain nuances. We've been through licensure change twice now. In 2007, we were able to introduce PGY1 as a licensure option in addition to the clinical exam. Before that time, we were a NERV state, what you would call a NERV state. Sometimes other regional exams were accepted, plus and minus certain caveats. You know the story across different states that are like that. So since 2007, we've had the PGY1 option, but we've continued to work on what we think is the endpoint we really want, so that this year we've achieved a legislative change where over a transition period of 2 years, by July 1, 2021, we will maintain the PGY1 pathway as we've had now since 2007, but we'll also have an examination pathway, but that examination must prohibit licensure exams which include patients or active patient care. So we were not prescriptive in suggesting what that option might be. It will be up to the State Dental Commission or the Department of Public Health to decide what that option is. And one of the reasons we're able to make this successful was making the case that there are now options that are not just options, but better options in terms of licensure, like the DL-OSCE, like Portfolio, and other approaches. So we were also able to achieve some change in terms of portability. Before this year, we had a 5-year out-of-state licensure requirement, and those individuals would have needed to pass the NERV exam or something equivalent. Now, effective immediately, we removed the NERV requirement specifically, so we will grant licensure after 1 year of practice to anyone who's a graduate of a CODA-approved dental school and has passed national board exams and is in good standing after 1 year of out-of-state practice. So we become like Colorado, except for the 1 year out-of-state requirement, which we feel will really address almost everyone with a portability question. So just some comments. I think it's important wherever you are to, as you start your activities, to determine what type of state you're in, whether the State Dental Board or the State Dental Commission has the prerogative to make change independently. if the Practice Act allows that, or if you're like Connecticut, where the state dental board can only make decisions as described in legislative language or in the statute. And in our case, we had this not peculiar, but we had this statement that individuals taking an examination must take a practical examination, which under legal review was determined to mean an examination involving patients, on patients. I think that tracked back to 1947, actually. And so we knew we had to go into a legislative approach to make change. So we did this both in 2007 and then just this previous year. Next slide, please. So here are our lessons learned, and Sean has mentioned a few of these. Partnerships and coalitions are critical. They're critical on a national level, but they're also critical at the state level. Groundwork, including resolutions, are very helpful. So ASDA has its resolutions, ADA does. The ADA does. It shifted somewhat over the period of time. In our case, it was very helpful that our State Dental Association also had a supporting resolution. I think it's important to engage your state dental board early, independent of what type of state you are, so that you're clear with your intent, so there are no surprises to the state dental board. Sean mentioned this. There's a period of time that's going to take longer than you expect in terms of engaging and educating others, especially at the legislative level. It's going to probably take a bit more time than you expect, and some of those times will be uncomfortable. What I mean by that, we're in a small profession, and these could be friends in the profession, it could be alumni, it could be others, it could be faculty actually, who disagree with your approach or our approach or our intent. And you just need to be ready for those uncomfortable times. And in that, I think is really important to take the high road. This is where we're a little bit different from the Iowa experience. We concentrated on ethics right from the beginning and use that as our reasoning for change. And also, we always try to keep the high road in terms of our interactions. We tried to stay out of heavy debates and kept to a civil discussion. And as Sean mentioned, you need to be persistent. Don't give up, because there will probably be some early disappointments or early barriers. So just like to focus on a few of those. Partnership, I think this is where ASDA is so important. I see two roles for ASDA, really, two primary roles. As the initiator of the discussion, especially in a state where perhaps the dental school is not that engaged in the idea, or the State Dental Association hasn't considered it in detail. So ASDA can be very helpful in reaching out to the faculty, reaching out to the dean, reaching out to the executive director of the State Dental Association to trigger this discussion. From our experiences, it was essential to have the dental school and the State Dental Association together in this initiative, along with our students. For the dental school, it brings a certain type of legitimacy and sort of an academic and trusted voice, especially if you're in a public dental school, because most states consider their public dental school to be an extension of them. We felt we needed faculty support. So Sean, I was interested that your faculty council or faculty government voted in favor of this change, as ours did as well. So then we could go to everybody and say, it's not just the dean, it's not just a small group of faculty, but it's the faculty in total who are concerned about this. Our students were involved either through their ASDA chapter or their ADA chapter. We felt we had to inform alumni because we knew some alumni may not agree with us, and we wanted to be above board. But in the actual case, what we found was most alumni were very supportive. And in our case, we felt it was important for the dean to take the lead, that it wasn't a faculty member representing the school, but the leader of the school. So it's sometimes difficult to align priorities. Sometimes they're competing in terms of legislation. So think about getting the government relations people together. That included our government relations people from the university. So Sean, the same approach with us. We engaged the university early, and our government liaisons became interested in this and actually took a major lead. We found at its committees on legislative level, students gave the most compelling testimony. in terms of storytelling and their experiences as students. And we also try to engage some other groups, including access and citizen rights groups. So other lessons learned. I mentioned that if your state your state dental association could possibly have a supporting resolution, it would be helpful as you get into these discussions a little bit further on in time. As I mentioned, inform your dental board early. Seek out and educate supporters in the legislature's committees, all those groups that Sean spoke about. Many will not be aware of this issue and will need to start at the ground level in terms of educating those individuals about the issue. And that includes the department to which your state dental board may report. The department takes advice from the dental board generally. They may not hear of these issues until you arrive at their doorsteps. And it will take time, repetition, and perseverance, as Sean mentioned. So for us, a little different from Iowa, we found that the ethical concerns were had the most compelling and persuasive ability. We found that as we got into discussions about competency, what competency is, and what about validity and reliability, that legislators and committee members tended to get lost in that discussion. They swayed more to the ethical issues, the big picture issues. What about the patients who are actually citizens and constituents of these legislators? Students, the situation they're placed in, the compromising situation they're placed in, and the schools situation that it's many times these exams are counter to the standards of care and evidence-based care. Again, I think you all know this, student and faculty testimony is important, and there we got into the details of the ethical issues, including recruitment, bartering of patients, the dentist-patient relationship, those things. And again, we had to continually stress that this is a new age. It's not like 5 or 8 years ago where we questioned what the options may be, but now there are several options and possibly better alternatives to the patient-based exam. So I would say this, and Sean, you may recognize this as well as this can take a number of years. We anticipated when we started on our second initiative, it would take 3 to 5 years, and it took 4 years. It took 2 legislative sessions just to educate the legislature and the committees on this issue. And then it took 1 bill that failed for reasons not related to licensure, but the second time around, the bill passed. So it took 4 years for us to reach that second endpoint, which we're very appreciative of. But over that time, there'll be ups and downs. There'll be some disappointments. And what we found, it was important for the partners to keep each other going, because sometimes you start to lose steam, and it's important for that partner to nudge you forward, or for us to nudge others forward. And I think that's just as an important role for partners as the strength it gives to the overall initiative. So I'm happy to answer any questions from a Connecticut perspective, and pass this back to Craig.
Great. Thank you so much to Dr. O'Neill and Dr. McNeil for not only sharing your experience with our members tonight, but giving us a taste of success and hopefully inspiring students out there to get the process started within their state back at home. So for right now, we're going to go ahead and move into questions. Remember, you can type questions in to your sidebar in the GoToWebinar control panel. All right, so we see one question that's come in so far, and this is for Dr. McNeil. When talking about licensure reform, what is the most likely counter argument that I should be prepared for? Okay,
there are a number of arguments that kind of flow together, and first, I think there's somewhat like this. First, that these exams, these patient-based exams, are actually valid based on internal analysis. Unfortunately, we seldom see those analyses, and it's sort of that's where you lead into the question about validity and reliability. That these exams have fidelity, that they're actually since it's actually, the exams are on patients, so they have the greatest fidelity of all types of exams. There's sort of a hidden message there that the only reliable tests are on patients. I think you will also hear that, especially in terms of ADEX, that exam has the greatest chance for portability, to achieve portability, since over 40 states recognize the exam in some way. So why move into another realm in terms of portability? And lastly, you'll hear the comment that this is really all about schools and students wanting an easier track, that we somehow want to lower the standard. And of course, we know that's not the case, that in fact, in some of the options we're looking at have been shown to be more rigorous with higher failure rates. So those are the questions those are the reactions we heard. We found that moving back to the question of ethics was the best way overall to address those issues.
Yeah, thank you, Dr. McNeil. So we've got another question that's come in, and this one might be more suited for Dr. O'Neill. Why is it important for D1 and D2 students to get involved in licensure reform, and what are their first steps?
I think it's really important for D1s and D2s to get involved, because as you heard me say earlier, and Dr. McNeil, it took him 4 years. It took me well over a year. And so if you wait until your third or fourth year to start it, you're going to be graduating and you're not going to be there anymore. And I think a big reason licensure is still the way it is because people graduate and forget and stop fighting the battle that they would have fought before they graduated. The number of students that would graduate and move on and basically tell me they didn't care anymore was probably about half, because they were past it. And a lot of people have a mindset, I went through it, the younger generations can go through it. That was one of the common things that I had heard from the people that had graduated prior if they were not supportive.
Yeah, thank you, Dr. O'Neill. So the next question, this one's for Dr. McNeil. What are the best ways to get in contact with Congress members within my state so that we can start the conversation for licensure reform?
So I think the best place to start is with your state rep from the district that represents your university. Sean mentioned this. It's important to work with your university on this from the beginning because there will be political issues here that may come back to the university, to the president or provost, whoever, at some point. So it's best to have that discussion early and to gain university support. But generally, the state rep for the university district understands university issues and tends to support them. So that's an important area. Alumni who might be members of the legislature, and I would not restrict this just to dental alumni. We found medical alumni to be very helpful. There happen to be more state reps who are MDs than DMDs. And MDs found this unusual in terms of our current licensure process, intended to be supportive. So, and I mentioned this already, in terms of the liaison, the university liaison, generally a dental school will not have its own liaison. It will be part of a university effort. It's important to work with that liaison so they understand the issue, and then work with their contacts and friends in the legislature to find, as Sean did this himself personally, to find that champion, I think he called it. Sometimes your liaison can identify that champion or champions as well.
One of the things I want to jump in here and give to it related to this question, but one of the things I did is use dental students, and I found where every representative's hometown was and would look for dental students that were from that hometown or had graduated in the last 5 to 10 years that lived in that town. I also then used the dentists from that town that were part of the dental associations to see who I could have support there. And I had the actual students or dentists from that community reaching out to those people. So a little bit not necessarily the introduction to the representatives. I completely agree with Dr. McNeil on how to get started. But after you get started, when you want to start targeting certain people, that would be the approach I have. They're much more likely to listen to a student or a dentist in their town than they necessarily are somebody that is not from their area at all or is not a constituent of theirs.
Great. So we have another question, and Dr. O'Neill, I think this one's a good one for you. As a student, how would you recommend starting this conversation at your own university?
I think, and Dr. McNeil and I have both kind of hinted at this or mentioned this, but I think the number one thing to do, and I know this was in his presentation, but is to find out where your dean stands on this topic. Where do your faculty stand on this topic? If your dean and faculty aren't supportive, it's going to be a much bigger or much more uphill battle for you as a student to do so. I was fortunate that my faculty and dean were very supportive. But I would mention, just because the dean isn't, or just because certain faculty members aren't, does not mean that as a whole, most of the faculty or the college are not supportive. So one of the big things that I would try to do is get your faculty to make some sort of vote or make some sort of comment or statement from faculty councils that serve at that college, specifically inside of the dental school. After you have the support of the dental school, then I think there's kind of two directions you can go. You can go through the student side or the administrative side. The student side would really be using your representatives that are part of bigger student governments. In my situation, that was myself that was sitting on the graduate government, and taking it to that bigger body and having the graduate governments or the student governments start making a statement or stance on the issue. The dean or the administration and the faculty at the college can take it to faculty senates for the university. The dean can take it to the provost, and get those people involved to start spreading it up the ladder. Really, the people at the university, or at most universities that matter, is kind of the dean first. That's going to go to a provost or a council of deans at the college, depending on the size of your college and university. And after the provost is on board, then it typically goes across the president's desk. A lot of times more so as a, this is what's happening, we want you to be aware. Typically the president doesn't like to get involved in those right away unless he thinks he absolutely has to, but the provost typically will make a stance on something like that. So that was kind of the direction I went, and I think is kind of a good direction to start is, you know, with faculty and dean first before you go outside of the dental school.
Yeah, I think that's great advice. Thank you, Dr. O'Neill. So just one last question for tonight, and I guess both of you could quickly address this, but if each of you had a chance to redo the licensure reform process within your state, is there anything that you would have done differently?
I can see,
Well,
Dr.
you know, you go ahead, Sean.
Oh, I was gonna say, I could tell you were thinking a little bit, and I have several things that I would probably have done differently now, now that it's 2 years later, or a little over three, I guess I'm closer to 3 years later. But at the time, there was a lot of pressure from the dean and from the administration at the college to get the legislation pushed through as quick as possible due to several reasons. There was some concessions made that I wish probably wouldn't have been made. The original legislation opened all pathways to licensure, and we restricted that down to more so the portfolio and all regional exams, but left some verbiage that would allow for future ADA recommended exams to be considered. They're not blocked by the legislation. It kind of left it that the legislation would recommend those exams to the dental board. It was pushed through for several reasons, but that was probably my biggest regret, is making those concessions, because we probably didn't have to, but it was also what helped get it through as quickly as we did. And it was done for a lot of the students and at the school at the time, a lot of my classmates that wanted to be able to take other exams, and be able to change how credits is being administered. Because one of the things I didn't, I guess, mention in my 10-minute presentation there, but in addition to all of the exams being accepted, credits became more integrated. And I don't want to call it the Buffalo or the curriculum integrated models, because it was a little bit different. But we made several agreements with the dental board and credits that the exam would be offered 5 different times that year. And there was some clauses in there about faculty being able to look at failures, be in the clinic, being a little bit more integrated into that process. In addition to that, if patients didn't show up, the students were not failing those sections. They would just take it the next time that credits was there. So there's a lot of those integrations, and that's why we kind of agreed to push it through. But we made concessions that I wish I wouldn't have given up at the time, because it's going to be harder to go back and revisit it again within 2 or 3 years now that it's passed.
Great, thank you.
I guess if looking at through a crystal ball, it would have been easier to do some of these things now that there's a coalition and a national statement about licensure chain modernization. It was compelling in the last year to be able to speak about the coalition and 3 major organizations which supported, each with their own resolutions. When we started, we didn't have that, and it made it a little bit going a little bit tougher. So we started early, and I think I wouldn't change anything, but it would have been easier. I think it's good for everyone interested now that there are pieces in place that give a more compelling argument. And Craig, you mentioned the white paper, but also the TARP report, the Task Force for Assessment of Readiness for Practice, is an excellent document. You can give it to a legislator or to a department head or whoever that makes a compelling statement along both documents. So there's a lot in place now that wasn't in place 2 to 3 years ago, and I think that only makes the optimism higher.
One of the last things I want to mention too is one of the biggest issues I had was legislators asking if there was a precedent, or basically asking if legislation had been passed in any other state. When I did this in 2016, I could not find a record of any other state that had passed legislation really beyond accepting regional exams or accepting PGY1. There was nothing beyond that at the time that I could find as a precedent. And that was probably my biggest struggle with legislators was, well, there's no precedent for this. And in my situation, we were passing legislation that was going to supersede a state board, and that had never been done in Iowa. And we were struggling to find examples of that elsewhere. Yeah. And so now that there has been precedent out there, you can take that precedent. I would probably take Connecticut's over Iowa's because it is much more broad. You can take that precedent and say, yes, there is a precedent. This has happened. Other states are doing this. You don't want to fall behind.
Yeah, well, thank you both so much for your time. And I think now that we've had you two working on reform in Connecticut and reform in Iowa, we now have these 2 states to look at, and then, reference back when we're having some of these conversations. For everybody that's still on tonight's webinar, I encourage you to take a look at ASDA's website, asdanet.org, where you can learn more about licensure and what you can do within your state to reform the licensure process. And you can also use the search function in the upper right-hand side of ASDA's website to search for ASDA's white paper. Thank you for everyone for joining us tonight on this Advo-cast, where we took a little bite out of the big issue of dental licensure, and I hope to see you at future webinars and at ASDA's advocacy track at the National Leadership Conference. Have a good night, everyone.
Thank you.
Good night.